Competition Commission this week released its final report on its health market inquiry, which was conducted over 5 years. The report shows South Africans are paying far too high premiums for private healthcare, and in some cases, consumers are coughing up more cash for often unnecessary services. The Competition Commission's report also echoes the same sentiments of another inquiry in 2018, which stated that a lack of competition in the private healthcare industry is fueling increasingly unaffordable healthcare costs. Joining us now in studio, we've got Tembinkosi Bonakele. He's the Commissioner of the Competition Commission, to talk to us about the findings of the health market inquiry. Thank you for coming in. It's good to have you.
Thanks for inviting me. Morning to you and the viewers.
I suppose I have to ask, 5 years, why did it take so long?
Well, as you mentioned, in 2018 we issued a report. It was a progress report, if you like, an interim report on this. It's a highly complex sector, this, and we decided to go comprehensive. So we looked at medical aids, private hospitals, doctors, all sorts of specialists. And all of these, if you think about it, for you to get a service from a doctor, they have to interact. The medical aid must interface with the doctor with the hospital with the specialist, and for all we know, you might need your blood tested. So there are so many complex relationships, and it makes for a complexity in terms of how you understand it.
And it really is complex because it involves so much and so many different practitioners.
And lots of money as well, I should say.
Far too much money. So let's get to the bottom of it, because this is what's affecting people that use these facilities. So let's begin with private healthcare, and the fact that coming out of there is the finding that we pay far too much for private healthcare, way above inflation. And we're also, what you're finding is that are sent for unnecessary treatment. So let's begin there.
You see, the inquiry found that we have a problem because we don't really have competition. But this is a market, so you have private sector players in a market who are looking for profit. And usually what disciplines them is the competition. What would discipline someone from charging a higher price is knowing that a competitor is going to come and discount. But you don't have that in that sector. This is what the findings got. What you have instead is a situation where you have few dominant players, and they can be able to charge whatever they like. And we also found that this doesn't correlate necessarily into a better service. So you're finding that people are spending more time at the hospital, and this is not explained by the diseases or conditions that South Africans have. It's such that you have a possibility that people are profiteering by keeping people in hospitals, by keeping people in ICU, and by prescribing expensive procedures.
Yeah, and one of the big things that you have said in this report is that the Competition Commission is basically blaming the rising cost of private healthcare on the health department, on the National Health Department, for not going in there and looking at the competitiveness that doesn't exist there, and of course the inefficiencies. So talk to us more about their role in all of this.
Well, certainly there has been a regulatory failure. The Department of Health Parliament passed a law so many years ago, I think in the mid-2000s, that really empowered the Department of Health to regulate the sector. So things like licensing of private hospitals is really in the domain of the Minister of Health. Things like regulating prices and so on. So there has been regulatory failure. Certainly the department has some blame to shoulder on this. But also, I should say, we have intervened in this sector. For example, we blocked the parties from bargaining. So you previously had medical aids getting together and they would bargain with hospitals. And we said, look, in terms of the Competition Act, this looks like collusion. But what that did was to strengthen the most powerful and weaken the weaker. So, for example, doctors, they are not in a position to bargain with private hospitals or medical aids because they are weak and scattered. So regulatory failure is not only about the department, it's about all the agencies, ourselves included, who should have done better to protect patients and consumers in this sector.
Certainly, and it's a sad state of affairs when you look at the health sector in South Africa and how much it costs South Africans, because it's almost highway robbery if I'm gathering this. I mean, we look at the big three, because the private healthcare industry is basically dominated by three of the biggest players. We've got Netcare, we've got Mediclinic, and we've got Life Healthcare. And this is something where you come in and you're saying that these profits that they are having are immense, and it just does not add any room, because of what they pay, the perks that they're paying the medical practitioners, and all of the above doesn't allow for smaller competition to actually come in and flourish. So what's going to happen to them?
Precisely. I mean, when you have sustained profits, very high profits over a long time, that's an indication of a problem. And so one of the things that we are saying, because the market has failed, you need regulation. So you need tariff, maximum tariffs must be set by a regulator. So we've called for a supply side regulator to be able to do that. But we're also calling for centralization of licensing. There could be conditions that are imposed to people who are licensed. They could, for example, be directed to underserviced areas. So instead of having concentration in areas where you have affluent people who could afford and who you could overcharge, you could impose all sorts of conditions when you are issuing licensing. So that regulatory aspect, we think, is one thing that is going to help, even as government thinks about NHI. Because remember, when government has got NHI, it's a fund that's going to have to buy services, including buying from the private sector. Now, at these prices, NHI cannot be sustainable. So you need to discipline pricing in the private sector.
Any indication that there is collision happening?
Well, we didn't find smoking gun evidence, but when you have only three players, they don't have incentives to compete. You only have three groups that are really providing private hospital services, and nobody checks what is the bed price each is offering before they go to a hospital. Because the last time you make a decision as a patient is when you're deciding which GP you go to. After that is referrals. The GP refers you to a specialist. That specialist will be located in a particular hospital. So you don't make those decisions at all.
Yeah. And this is worrying when you look at things like this, because there also is no standardized quality healthcare outcome to compare against each other. And that's a big fault, and that's a big worry as well. So the recommendation on that, what have you said should be implemented?
Well, we're saying also there must be someone who is able to collate data in healthcare. We didn't even know the utilization of hospitals. We didn't know the occupancy rates. We didn't know which people are admitted for what conditions.
Those numbers don't exist.
Because there's always been this myth about confidentiality in healthcare, because it involves patients, and patients' rights are sacrosanct. So people then were very reluctant to release information. So for the first time we have that now. So we are saying that there must be someone who not just looks at information but also looks at standards. Because standards in healthcare is unlike a hotel. You're not looking necessarily for the nicest room. What you are interested in is outcomes. If you go there, you are sick. When you leave, what is your condition? And nobody is picking up that information and that data.
Yeah. I want to quickly look at medical health schemes as well, because I see that Discovery has been highlighted here as well. When we look at Discovery Health, when their profits are coming through, you look at them and they are far above anybody else, and this is massive. So I know what you're calling for as well is there's price uncertainty. There are such high profits coming from Discovery Health, and there's a lack of transparency, because a lot of people don't even understand what it is and how your medical aid actually works. There's so many different aspects and fundamentals and things happening, and the medical savings plan comes from here, and so we are just very, confused by everything. And as soon as you confuse a nation, then they just pay. It's like, all right, well, I'm just going to pay. And I'm one of those people. So what you're actually calling for is a new standardized payment option. Talk to us about this.
So what we're saying is that there's so much choice that you have as a consumer. At the end of each year, you must choose a plan.
Yeah.
But you don't know the basis of this plan, actually.
No.
Nobody really knows. So the first thing we're saying is that please simplify this for people so that they can make informed choices. Have a standard plan. They must know what's covered in that plan, including the out-of-hospital expenses that could be covered by the plan, because at least everybody is going to know that that's the base. So you can know what will be an additional service you may get if you want to go above that plan. So that's the starting point. The second thing is that improve governance of the medical aid schemes. You know, the schemes are supposed to be owned by members. But how many members go to an AGM and actually ask questions? And who holds administrators? So Discovery has got an administrator. There's a Discovery administrator. That's the company that's very profitable. But the Discovery scheme, which is members, which include me, who are supposed to be holding them accountable, they are not doing that. Certainly, if the profits that you are referring to are a problem and not related to the service, then we have a governance problem somewhere there.
You also highlighted that there are warning lights to look out for in terms of mergers. When you talk about mergers in the private healthcare industry, whether it be with medical aids or whether it be with health facilities,
right.
That is a big problem as well, because this is obviously to protect themselves. So what's going to happen there going forward?
Well, we have to be very strict in allowing mergers. We are allowed to block mergers or impose conditions. So let me tell you what's happening, especially in the private hospital sector. People go and get licenses from provincial governments to start hospitals. And those hospitals presumably will compete with existing players. But as soon as they get that license, they go and sell to the incumbents. So in fact, you will never have emergence of competition. So what the inquiry says is we have to be very strict on those takeovers as the commission, but also the regulators that must approve licenses. Because when you grant a license and there's a change in ownership, you are supposed to approve that change in ownership. This is one of the regulatory failures, because government has been approving all of this change in ownership without looking at the impact in the overall market.
Two more questions. One, do the findings, I mean, there's so much to talk about, and I know we don't have too much time, unfortunately, but do the findings from this report give more fuel to allow NHI to take off? Does this show you that we're in a very big problem here in South Africa with healthcare?
Precisely. What we're saying is that you've got to fix the problem. And fortunately for South Africa, to many people's surprise, we're spending enough money on healthcare. We are comparable to Germany and other OECD countries in terms of the overall spend. What we have is inequity and poor outcomes.
Yeah.
So a lot of people are being overserviced and a lot of people are being underserviced.
Overserviced and overcharged.
That's right.
And then you have a sector that is getting nothing.
That's right. So that's what you've got to fix. You've got enough resources. What you need is a system. And I hope that the NHI gives us that system. But we're saying it will not be sustainable at these prices that the private sector is charging. So you've got to fix that first.
Yeah. Finally, we look at the recommendations, and I know I've been asking you very much so about this, but I know that you're saying we need a watchdog to regulate healthcare suppliers. That's one thing. You need an information hub for hospitals, private healthcare, for everything. Changes to ethical rules of the Health Professions Council of South Africa. The other recommendations, they're being passed on to the Health Minister. Are these going to be implemented? Or is this going to be another report that sits waiting to find implementation?
Well, I hope, and the signs so far have been quite positive. The Deputy Minister of Health was there when we presented the report. Minister Patel was also quite supportive and made sure that assured us that the report will be tabled both in Cabinet and in Parliament. So we expect a lot. And just on ethics, by the way, this issue of keeping people in hospital, these are decisions doctors make, and they're supposed to be making these decisions in the interest of patients, not in the interest of hospitals. You know, hospitals set targets for keeping people in beds. You can't have that. So that's an ethical issue that's got to be fixed.
We need a lot more transparency in this sector. We really do. And I hope that this is the start of it all for more reasons than one. I think you've outlined a lot of them. Tembinkosi Bonakele is the Commissioner of the Competition Commission, talking to us about the findings of their health market inquiry that was released this week. I urge you to go and read it. It makes for fascinating reading. And, you know, we just touched on the surface here. There are a lot of details to this health market inquiry that affects you directly. So go in and have a look at it. All right, let's take a break. Thank you again. Let's take a break. We'll see you after this with more.